students, this is Miss Lamport. I'm going to talk to you today about drawing blood. And the first thing I would like to do, venipuncture as we call it, or phlebotomy, which means making an incision into a vein. What I want to do first of all is I want to go over the parts that's necessary for us to do our blood draws. And the first one I want to talk to is about this long strip of rubbery type material that's called a tourniquet. The tourniquet is necessary to place on the patient's arm, and what it does is it causes the blood to pool and your vein to distend so that you can draw the blood. So the way to work with a tourniquet, you find the person's arm, you find the antecubital fossa, which is the bend in their elbow, and then you place the tourniquet under their arm. You want to make sure it stays flat on the bottom, and then you want to be about that 3 finger widths above the elbow. So then you're going to take it like this. I like to lay mine down like that. Then I like to grab this one that's right here and pull it really, really tight like that. Then I lift this one up and I go under and I pull down. And then when I'm ready to remove it, I just simply pull this one and it pops off very easily. Some things you don't want to do is that when you're tying it, that you're trying to make it like a bow and you're doing like that. Because when you do like that, you can't pull it off, okay? So you want to, again, put it about 3 finger spaces above their bend in their elbow. Place this one down. Take the left hand, if you're right-handed, and stretch this real tight. Then pick up on the right hand, leave your fingers under, raise it up, and put this down, but do not pull that and make it into a tie. Because when you're ready to take this off, it should pop off so simply, and you're done. Okay? So hopefully everybody understands the purpose and the use for the tourniquet. The next thing that we're going to talk about, and I'm going to just get the parts that we need, is going to be the part that you need to draw your blood with, and that is this little part right here that has a flange on it, and it has a tip on it, and this is called a hub, all right? And you take your hub, and this is a multi-draw needle, and it has actually needles in both ends. You don't see the needle that I'm going to show you on the first end because it's covered by a rubber stopper type material. This one is where the actual needle is. So you always want to take off your clear, kind of a whitish clear plastic one first. And so you want to pull it away. You can pull it out like that. And now you see it doesn't look like it has a needle in it. But when I take and pull this rubber stopper piece down, you can actually see that it does have a needle. Because when you place the tube in there, this part goes down and the needle sticks into the rubber part of the actual tube itself. So now this attaches to this part and you screw it on tightly. You want to make sure it's tight because you don't want it coming off of the patient's arm while you're trying to work. And this is the way your hub with your multi-draw needle will be when it's attached. Now, when you're ready to actually use the needle, then you're going to take off this black cover. And again, I say always pull anything that's got a needle on it to the side. You're going to pull it like this, and then you're going to see that you have your needle. And it does also have a shaft. It has a shaved off portion called the bevel. It also has a lumen and a gauge, and it has a point as well, just like the needles that you would give an injection. And again, we don't want to put the cap back on with our hand. One hand scoop method, and then you're ready to go with the needle. Okay? All right? So then your other parts you'll need will be your tubes. So whatever test the doctor has ordered, you'll pick the particular tube that's supposed to be used for that particular blood draw. Then you have your gauze that you're going to place on your actual site once you take the needle out. And then I'm going to show you what I like for us to make, and that's called a pressure bandage. You always want to put a pressure bandage on your person's arm so that it helps to stop the bleeding. So you're going to take a 2x2, and you're going to fold it into fourths. And then you're going to take your Band-Aid, or you can use a Coban wrap that goes on it as well. It depends on what your patient prefers and what your doctor's office has to order. So then you take your parts off of your Band-Aid, and you place this gauze piece right here in the center of your Band-Aid, and now you have a nice, neat pressure bandage. And you always want to take the original gauze off of your patient's arm before you put their pressure bandage on, okay? So, and of course you need your alcohol to clean the area before you draw the blood. Another thing about that is once you have cleaned with alcohol, you cannot go back and touch that area again. If you touch that area again, you will contaminate it, okay? Even if you have your gloves on. All right, you cannot do that. There's ways to mark it. Let's say, for instance, you found a vein and you were not sure where you found it. So you take the cap of one of your, the needle, and you can actually take this and place it on their arm over the vein and make a little, it'll make a little indentation in there, and then you'll know exactly where you need to stick that person to be successful for your draw, okay? It's actually a gray tube, and the gray tube actually has 2 anticoagulants in it that you have to be aware of. It has sodium fluoride and potassium oxalate. So sodium fluoride and potassium oxalate. And if you can see on some of these, it actually looks like a white powder. This one is another one that they spray it in so you really can't see it. But some of them actually have down at the bottom a little white powder that's there. Now this one has 2 because one of it's a preservative and one of it's the anticoagulant. So again, this one has sodium fluoride and potassium oxalate. This one is normally done for glucose testing. Okay? So again, you have your yellow, your light blue, your red, your speckled top or your serum separator top. Then you have your green, which has heparin. You have your lavender, which has EDTA. And then you have your gray, which has sodium fluoride and potassium oxalate. The one I don't have that I want to include is a royal blue one that has EDTA in it, but it's a sterile tube. It's done actually to collect lead screening and those type of things. So it's a sterile tube inside. It doesn't have any, you can't see anything that would cause any problems with you finding trace elements and lead in that tube, okay? So that would be the ones that are most often done in a doctor's office. Or is that the only color tubes? No, you have black, you have pink, you have tan, you have a lot of other colors, and you have a different type of green. So no, this is just the main colors that would be used most often.